Hello everyone, welcome back to our channel CPC ADDA. In this video, we will discuss about qualifying circumstances. Okay, anesthesia qualifying circumstances, right? For any medical procedures, there is generally an expected duration such as 1 hour, 2 hours or more, right? This duration typically depends on the complexity of the procedure, right? Anesthesia plays a vital role in keeping the patient unconscious throughout the procedure. So it is administered based on the estimated time required to complete the procedure. So however, certain situations can alter the nature of anesthesia administration. These unique situations or scenarios are referred to as qualifying circumstances. Okay, so there are four recognized qualifying circumstances and they are reporting as add-on codes. Okay, they are reporting as add-on codes and to indicate additional factors that affect anesthesia delivery, right? These always you should add with the anesthesia procedure code. Okay, these are only add-on codes, not you should not use these codes as a standalone codes. Okay, let's see what are that four qualifying circumstances now, right? So these are the four qualifying circumstances what we are having currently, right? So one is 99100 for anesthesia for patient extreme age younger than 1 year or older than 70 years. It is younger than 1 year or older than 70 years. It means less than 1 year or greater than 70 years on the day of procedure. Okay, and next code we have 99116 anesthesia complicated by utilization of total body hypothermia. Okay, patient if having hypothermia, it means low body temperatures, right? Low body temperatures. If patient having low body temperature while administering anesthesia, you have to use the 99116. Okay, and 99135 for anesthesia complicated by utilization of controlled hypotension, low BP. Okay, patient having low BP while administering the anesthesia, then you have to utilize qualifying circumstance 99135. Okay, so another code we have 99140 for anesthesia complicated by emergency conditions. Okay, emergency conditions. What are emergency conditions? Any emergency is defined as existing when delay in treatment of patient would lead to significant increase in the threat to life or body part. Okay, so any situation happen and not going to provide treatment immediately and treatment getting delayed, in that case that situation becomes threat to life or any body part. That situation is called emergency condition. Okay, for example, if something happened in the morning and till the evening they are not giving any treatment, it is getting delayed, so that situation getting more worse and now becoming it is threat to life or any body part. So this situation is called emergency condition. If patient having like that situation, then you have to use 99140. Okay, so let's see again 99100 for patient is extreme age younger than 1 year or older than 70. If patient having less than 1 year of age or greater than 70 years of age, then you have to use this qualifying circumstance code 99100. Okay, and remember one thing, if say here they given one instruction, right, for a procedure performed on infants younger than 1 year age at the time of surgery, C 00326 00561 00834 00836. These procedures anesthesia codes already performing to patients with younger than 1 year of age. In this particular procedures you should not add again 99100 code to represent less than 1 year of age, because these procedures already covered that less than 1 year age, right? So if you are adding these anesthesia codes 00326 or 00561, 00834 or 00836, you should not add 9911100 separately. Okay. And next qualifying circumstance 99116, this is for if patient having low body temperatures. Okay. So 99135 is for low BP. Okay. And 99140 for emergency conditions. So these four circumstances will alter the anesthesia administration time. That's why we have to list separately these circumstances codes with along with the anesthesia codes. Okay. If say for example, if we give a sedation to hypothermic patient or hypotensive patient, okay, hypothermia means low body temperature, hypotension means low BP. If say we give sedation to these two people, this type of patients, if you give the anesthesia, patient will get consciousness and sense before actual time given sedation. If say for example we given sedation for 2 hours, okay, 2 hours sedation we given, 2 hours we calculated anesthesia, then how much doses we need to give, those things calculated, and we given for 2 hours of anesthesia to this type of people, hypothermia and hypotension. But in these two circumstances, 2 hours before 2 hours itself they may get the consciousness and they will wake up. Okay, in between procedure itself they will wake up. So that is very dangerous situations, right? So these circumstances we need to report separately, because these circumstances will alter the anesthesia timing. So based on if a patient having this type of circumstances, then anesthesiologist will calculate anesthesia dosage accordingly and they will give accordingly. Okay. So you need to remember base units for this modifying physical status modifiers and qualifying circumstances. Okay. So base unit for 99100 is 1 base unit. Okay, 1 base unit. And 99116, that is for hypothermia, 5 base units. Okay, 5 base units. For hypotension qualifying circumstance also 5 units. Okay. And 99140, 2 units, that is for emergency conditions. Okay. These base units given to each qualifying circumstance, okay, separately. For extreme age, younger than 1 year or older than 70 years, base unit is 1 unit, and patient having hypothermia, base unit is 5 units, and hypotension base unit is 5 units, and emergency condition base unit is 2 units. Okay, these units you have to remember. This will useful in calculating the billing the anesthesia. Okay, dollar value of anesthesia when you are going to calculate, these base units will help there. Okay, at the same time you have to remember base units for physical status modifiers also. Okay, physical status modifiers last video we have seen, right? P1, P2, P3, P4, P5 and P6, right? For P1 base unit 0. Okay, P1 base unit is 0 unit. So P1 is for normal healthy patient, right? Normal healthy patient. So base unit is 0 for this. And P2 mild systemic disease, right? Mild systemic disease. This for this also base unit is 0 unit. Okay, and P3 severe systemic disease. Okay, severe systemic disease, and base unit for this P3 modifier 1 unit. Okay, and P4, what is P4? Life threatening condition, severe systemic disease with life threatening condition. Okay, for this base units is 2 units. Okay, 2 units. And P5 moribund patients, moribund patient, for this base unit is 3 units. Okay, and P6 brain dead patient, right? Brain dead patient, base unit is 0 units. Okay, so these units for physical status modifiers P1 to P6 and qualifying circumstances also you have to remember. Okay, so base units for P1 is 0, P2 is for 0, P3 1, P4 2, P5 3 units and P6 0 units. And qualifying circumstances, base units for qualifying circumstances, what are that? 99100 for age younger than 1 year or greater than 70 years, base unit is 1 unit. And for hypothermic patient, base unit 5 units, hypotension patient, base unit 5 units, and emergency conditions, base unit 2 units. Okay, these things you have to remember. Okay, so let's see another example how qualifying circumstances will alter the anesthesia timing. We seen one example right here. For 2 hours anesthesia we given for hypotension and hypothermic patients, they will get the before 2 hours itself they will get the consciousness. So based on that, anesthesiologist will calculate and they will give the anesthesia. Okay, so for if say ketamine is a drug used for anesthesia for 3 hours, actually 3 hours, ketamine is a 3 hours used for anesthesia. Okay, so if say in general patient will use for 3 hours. Okay, 3 hours anesthesia timing will use ketamine. But if say if you give same dosage for people having age less than 1 year or having age less than 1 year or more than 70 years, if you give same dosage, they will get the consciousness after the actual anesthesia time, that is 3 hours. More than 3 hours it will take to get consciousness. For these type of patients younger than 1 year or more than 70 years patient, they will take more time to get consciousness. Okay, so based on the qualifying circumstances, anesthesiologist will calculate the anesthesia doses, how much they required based on their current situation, and they'll administer like that to maintain consciousness, unconsciousness throughout the procedure. Okay, so that's it for today's session. If you like this video, please like, share and subscribe, and refer to your friends or channel CPC ADDA. Thank you so much for watching. We'll see in our next video.